Thank you for coming in today. My name is Corey, and today we're going to be talking about Guillain-Barre Syndrome, which is something that we think you could possibly have. So what is it? Guillain-Barre Syndrome is a rare disorder in which your body's immune system attacks your nerves. So in that photo, you can see with the immune cells going after the nerves and attacking the myelin. So what are some of the causes? Well, there is no exact cause that is known, but 2/3 of patients report having symptoms of an infection 6 weeks prior to the symptoms coming on. And the kinds of infections include a respiratory or GI infection, which is in your stomach. And again, you can see what the infection looks like when you have Guillain-Barre syndrome. You can see the exposed fiber and see that the nerve is getting attacked. All right, so what are some of the risk factors that put you at risk for having this disease? Well, it can affect all age ranges, but as you get older, the risk gets worse and worse. And it's also more common in males than females. And so for you, that puts you at more of a risk because you're a male. And some of the symptoms that you might be experiencing, well, it often begins with the tingling or weakness starting in your feet and legs and spreading to your upper body and arms. In about 10% of people with this disorder, symptoms begin in the arms or face, but it's not as likely as beginning in the legs. As it progresses, muscle weakness can lead to paralysis, and so some of the symptoms that you might have because of the paralysis is difficulty with facial movements, a rapid heart rate, difficulty with bladder control, difficulty breathing, or double vision or inability to move your eyes. And there are some different types that we think that you could have, but the one that we think that you might have is Miller-Fisher syndrome, as you talked about how the paralysis started in your eyes, and it's also associated, it's less common in the US, but more common in Asia. However, because your symptoms started with your eyes, we think you could have this. The other kinds are acute inflammatory demyelinating polyradical neuropathy, which is the most common in Northern America, and it starts in the lower part of your body and spreads upward, which is why we don't think that you have this one. And then the other one is the acute motor axonal neuropathy, which is less common in the US but more frequent in China, Japan, and Mexico. So how are we going to go about to diagnose this? Well, it's difficult to diagnose in the early stages, but it's because its signs and symptoms are similar to other neurological disorders, and they vary from person to person. So your doctor is likely to start with a medical history and go through a physical examination, looking at your body and seeing how well you are. And then your doctor is going to recommend that they do a spinal tap, which is that photo where you see the needle going in. And that's when a small amount of fluid is withdrawn from the spinal canal in the lower back. And this is tested for the type of change that commonly occurs in people with this syndrome. And then they might also do an electromyography or nerve conduction studies. And those both are where they they test and send electricity through your body to test each of the nerves. And so they just send small shocks to your nerves to see which ones you're having difficulty with. So some treatment options for, there's no cure, but there's 2 types of treatments that can help with speed up recovery and reduce the severity of the illness. And that is a plasma exchange, which is when they take out the liquid portion of your blood, so the plasma, and separate from your blood cells. The blood cells are then put back in your body, which makes more plasma to make up for what was removed. And so what they're hoping in doing this is that the new plasma doesn't contain the antibodies that are going to fight and attack your nerves. And then the second option was immunoglobulin therapy, which is when you insert in healthy antibodies from blood donors through a vein, and so they're hoping that the high doses of the immunoglobulin from healthy blood with healthy antibodies will block the damaging antibodies that contribute to this syndrome. And then there's 2 other treatments that can help with your symptoms, and that includes medication, and that should help with your pain and the swelling and things like that, and then physical therapy, which should help you to regain some function in certain areas that you've lost movement. There's no known cure, but several treatments can ease the symptoms and reduce the duration of the illness. So for many people, it can take months and years to recover, but most people go along this timeline where they have the first signs and symptoms worsen for about 2 weeks, and then within 4 weeks, the symptoms reach a plateau, so they don't get much worse, and then recovery begins, and that usually lasts for about 6 to 12 months. While you're recovering, about 80% of people can walk independently after 6 months after the diagnosis, and about 60% recover full motor strength 1 year after diagnosis, and about 5 to 10% of people have delayed or incomplete recovery. And if this is found in a child, they're more likely to recover completely than adults. And if you want to look up some more information, you can either ask me or you can go to these sources to find out some more information.